Hello, I'm going to be doing my competency reflection 9. It's our last one. And this one is titled Evaluating Practice with Individuals, Families, Organizations, Groups, and Communities. So, question number 1 is to describe how you select appropriate methods for evaluation of outcomes at your practice site. So, really, my role at SCAP is updating the resource guide. I have some access to clients or customers, so sometimes I do get to work with them. So just basically choosing an evaluation technique at SCAP according to the objective of the program. I also consider quantitative and qualitative data. I also take it into account that each method viability in light of staff capacity. So recently we have been having troubles with their staff. They're lacking staff, so just having to kind of separate everything and not really, but being able to work with the customers because again we don't have as much staff, so or caseworkers. So just having to do try to just balance out that. And so this also would coincide with choosing appropriate tools such as surveys, focus groups, pre and post assessments, just depending on the population. So question number two is explain how you use knowledge of human behavior and the social environment and person in environment and other theoretical frameworks for evaluating outcomes. So the use of in-person environment, which is PI, I've talked about it before in my other presentations. It's a framework that to comprehend how how systemic inequality, poverty, and resource accessibility can affect a client's outcomes. So SCAP deals a lot with that in some certain cases, just because some of the counties that we work with or try to work with are kind of rural or considered rural because they don't have as many resources close to them. So using that, also using different theories, like using Maslow's hierarchy, just really evaluating client surroundings and how that can affect them in the long run. Again, just the benefits of the services. And so number three, I'm sorry. Explain how you critically analyze, monitor, and evaluate interventions. So basically with the clients, just looking over the case notes. Staying in touch with staying in touch with the service providers in order to engage continuous monitoring. It's even mentioned using data collection instruments like service utilization records and needs assessments. Just again going back to those notes to see what route the client is on to achieve those goals, because again SCAP is really working for self-sufficiency. And so this sometimes again looking back at those notes, it helps me collide with the case manager. So working with the managers and team members to change the tactics, to again look at that resource guide to see what other things are available to them in that area, just by removing obstacles and helping them to continue or going forward to their path or going forward through their path. And so question number 4 is describe how you apply evaluation findings to improve practice delivery at all systems levels, which is micro, meso, and macro. So I utilize evaluation results to enhance custom care plans on a micro level, again working with the case managers, to see where the client or customer stands. Working with the client instead of trying to create a plan that we think is best for them, working with them is the best alternative and the best results. So again, looking back at that resource guide, looking for alternative services, promoting more easily accessible options for a family. Again, an example, or a person. It says if family is not being benefited benefiting looking at that resource guide. So then this would be discussing the results with the team. This would be considered meso level, just to guide them, or not guide them, but we work together to guide each other. So then, for example, when conducting workshops, which I've been to some, provide more support. If several clients express difficulties completing housing applications, just working together again. Some of these, some of these, not problems, but issues. That sounds the same thing. Barriers can create gaps between the client and their their goal. So just having that influence from different case managers working together. But also I help bring about more significant organization changes at a macro level. Again, having that resource guide. Additionally, grant applications and policy recommendations that support SCAP's mission, and empowering the communities by addressing their necessities, whether it be addressing poverty or or even the need for food and stuff like that.